Hello everyone, welcome to your lecture on outcome identification and planning. In this lecture, these are the objectives that we will be covering. Let's go through a few definitions. What is outcome identification? After you collect your data, you analyze it, you formulate your nursing diagnosis, the next step is outcome identification. This is where you establish your priorities, identify and write expected patient outcomes, select evidence-based nursing interventions, and communicate the nursing plan of care. This is your goal, your aim, or your end. This is basically the outcome that you want for your patient, right? Expected conclusion to a patient's health problem. Expected outcomes, specific, measurable criteria. Planning in nursing care involves using critical thinking, decision-making, clinical judgments, reviewing the patient's nursing diagnoses, collaborating with team members, prioritizing nursing diagnoses and problems, setting outcomes to guide that plan of care, and choosing relevant interventions for your patient's care. These are the different components of critical thinking that we utilize in order to achieve plan and achieve outcomes. Let's talk again a little bit about establishing priorities. Priority setting is the order of nursing diagnoses, patient problems in order of intervention. So remember in the last lecture we talked about problem-focused and negative diagnosis, risk diagnosis, health promotion and positive diagnosis, and prioritizing acute problems over chronic problems, collaborating with the healthcare team and the caregiver. When you enter nursing practice, you will care for multiple patients who are influenced by multiple factors. So it's very important to collaborate with patients, family, caregivers, and healthcare team members. You prioritize nursing diagnoses based on their urgency. Priority setting is the ordering of nursing diagnosis or patient problems to establish a preferred order. Patients' priorities sometimes change within a matter of minutes. Each time you begin to care for a patient, such as at the beginning of the hospital shift or during the clinic visit, review your diagnoses and priorities. Ongoing patient assessment is extremely critical to determine the status of a patient. Generally, problem-focused negative diagnoses take priority over risk, at-risk, and health promotion. Short-term acute patient care needs and problems typically take priority over long-term chronic needs. Ranking patients' diagnoses in order of importance and always monitoring changing signs and symptoms of patient problems, you attend to each patient's most important needs and better organize ongoing care activities. Once again, these are the different levels of priority. You have high priority that are emergent, life-threatening. For example, ABCs, safety, pain. And you can use Maslow's hierarchy in order to help you to kind of gauge this as well. Intermediate priority is non-emergent, not life-threatening. This is your medium. Then we have low priority, not directly related to specific illnesses, or they address long-term, needs of the patient. Let's think critically for a minute. What problems, these are the questions that you need to ask yourself when you're trying to prioritize. What problems need immediate attention? What could happen if I wait to attend to them? Which problems are my responsibilities? When do I need to refer to somebody else for one of those? Which problems can be dealt with by using standard plans? Which problems aren't covered by protocols or standard plans but must be addressed to ensure safe hospital stay and timely discharge? So these are the questions that nurses think of all the time when they're trying to prioritize care for their patient. So this is Maslow's hierarchy of needs, and as you can see, you have the basic physiological needs as the first most important need of the patient on the bottom. These are your basic needs. right? Oxygen, nutrition, fluids, body temperature, elimination, shelter, sex. These are the basic physiological needs of the patient. And as we move upward, the topmost, the self-actualization is actually the most important. But these basic ones need to be fulfilled to reach the very top ones. And like we mentioned in the past, sometimes they don't go in a linear fashion all the times. Sometimes you might find that, say, oxygen needs trump physical safety, even though safety is above oxygen, but it can still trump safety if the patient is hypoxic and they don't have, enough oxygen, and you have to take care of that emergent need. Let's talk about outcome identifications. What is an outcome? It's an effect of a healthcare service or intervention it's the effect a healthcare service or intervention has on the health status of a patient. What is an expected outcome? It's specific statements of behavior or physiological changes that you expect that will come from your interventions. So there are two purposes of setting outcomes. It helps you to set a clear direction, and it sets a specific measure for evaluation. So you can evaluate it later to see if it worked, right? Now, it's important to, understand this is a very important part of the process. You have your assessment, you have your diagnosis, then you have this is your planning phase, where you're planning your outcomes, your nursing outcomes classifications, your interventions. So let's look at goals. Long-term versus short-term goals. This is box 17.2 from chapter 17 of your textbook. So long-term means basically greater than a week. And short-term is few hours to days, basically less than a week. So these are goals that you're going to set for your patient. Most of the time in acute care, we have short-term goals. And long-term goals are something that we help patients set when they're discharging, or it's like a health promotion goal. Let's look at some examples. These are some nursing diagnoses, and outcomes. A patient-centered outcome reflects a patient's highest possible level of wellness and independence and function. It is realistic and individually based on the patient's needs and resources. A patient-centered outcome reflects a patient's specific behavior, not your own goals or the delivery of nursing interventions. For example, let's look at the first example. You have acute pain related to trauma of surgical incision. What are your expected outcomes? Patient has acute pain related to their surgical incision. Your expected outcomes are Mr. Lawson reports pain at a level 3 or below by discharge. You want the patient to have less pain before discharge. That's your outcome. Mr. Lawson walks to the chair with no increase in pain in 24 hours. So now these are measurable, right? It says pain level of 3, and by when do you want this, right? He'll walk to the chair with no increase in pain within 24 hours. So they're measurable, smart goals. Now let's talk about nurse-sensitive patient outcomes. Nurses monitor and manage patient conditions and diagnose problems that can be treated with nursing interventions. Thus, it's essential to measure the patient's outcomes that are influenced by nursing care, right? For example, look at the definition of this. Measurable patient, family, or community behavior or perception that is measured in response to nursing interventions. So you performed an intervention, and what was the outcome of that intervention? Valid and reliable means to support nursing care, quality, and performance. There are three categories that you can, set your outcomes for. Patient's functional status, maintained or improved. Did the patient's functional status improve? Is it being maintained, or did it deteriorate, right? Then we have patient safety. Was the patient protected, or was the patient harmed? So these are the outcomes, your outcomes from your interventions. Another category is patient satisfaction. Is the patient comfortable or content? So let's look at an example of patient functional status. Say the patient was having difficulty transferring from the bed to their chair. So if say, for example, after your interventions, the patient was able to get up and from the bed and sit on the chair. So now is the patient's functional status improved or, maintained? It was improving, right? And because now they're able to get up and sit on the chair. Patient safety. Were you able to protect the patient? Yes or no? So that's another example. And then patient satisfaction. Patient had pain, you offered pain medications, and the patient's pain has reduced, so now the patient is comfortable. These are some examples of nurse-sensitive outcomes. Pressure injury prevalence, falls with injury. So hospitals monitor these, as a quality improvement measure, right? And these are all nurse-sensitive outcomes. Nursing outcome classification. It's a resource to select patient outcomes. It's a valuable resource. It helps for us to select nursing outcomes, which links these outcomes, and they're also linked to NANDA and, NANDA nursing diagnoses. So for each diagnosis, there are multiple evidence-based outcomes. So if you look at the NANDA nursing diagnoses resource, it will give you, for each diagnosis, it will give you a list of outcomes, right? And it has a rating system, which adds objectivity to it. So it's not completely dependent on the nurse to rate whether it worked or not, right? So it will have certain scales that you can use to evaluate whether it worked or not. So using a nursing outcome classification provides consistency in evaluating the effects of nursing interventions over time and across a variety of healthcare settings. It's using a common language for outcomes allows nurses to plan effective patient care and provides a standardized way to measure whether nursing interventions are successful or not. These are some examples of nursing outcomes. For example, you have a nursing diagnosis that's activity intolerance. How, the patient does not have, cannot tolerate activity with comfort, right? So example of a outcome is activity tolerance. So if the nursing diagnosis is the negative diagnosis of activity intolerance where the patient is not able to tolerate activity, your outcome that you set for your patient is you want them to tolerate activity. And so outcome indicators are what? Oxygen saturation. The oxygen saturation with activity improved, for example. Pulse rate with activity decreased, right? The respiratory rate with activity is better now. So these are ways that you can measure whether the patient has become more tolerant with activity or not. It's very important, once again, to write SMART goals. We mentioned this earlier too. Same way with goals, you want to make sure you set SMART outcomes, right? Specific, measurable, attainable, realistic, and timed. These are extremely important for you to set. So let's talk about some examples with this. For example, specific outcomes. An example of that would be patient ambulates in the hall 3 times a day by April 22nd, right? And it's instead of writing something like ambulate patient in the hall, which is an intervention, it's not an outcome. Then you have, for example, you want something that's measurable. So body temperature will remain below 37 degrees Celsius, and apical pulse will remain between 60 and 100 beats per minute. This allows you to objectively measure the physical changes, but never use qualifiers such as normal or acceptable or stable. For example, don't say the body temperature will stay within normal limits or the apical pulse will be normal or stable. We don't use those terms. You need to be able to describe the quality, quantity, frequency, length, weight, everything about your outcome, whatever is relevant. Then attainable. You want to make sure that they're attainable, that they're realistic. Always consider what's attainable for the patient, not for you. What's attainable for the patient, right? So you have to discuss the goal, these outcomes with the patient to set them. So let's look at, for example, realistic. Okay, patient will wash hands and face in 72 hours. So impaired ability to perform hygiene, that's your nursing diagnosis. And your outcome is patient will wash hands and face in 72 hours. So it's very realistic and it's attainable. And then you want to set times for, your goals. You want to make sure that they're timed by discharge or by, January this, or you want to make sure that you have a time limit on it. So let's look at these two, see whether they're correct or not. How would you evaluate the outcome when you determine, for example, patient's lungs are clear to auscultation and a respiratory rate is 24 breaths per minute by 822? So is this a good outcome? So now over here, you have too many things over here. You want to focus on a single outcome. You're saying you want the patient's lungs to be clear to auscultation and respiratory rates 24 breaths per minute by 822. Now, how would you evaluate the outcome when you determine that the lungs are clear, but say the respiratory rate is 28 breaths per minute? So you can't really evaluate that, right? Because you have one thing but not the other. So always focus on a single outcome. This enables you to decide whether you need to modify your plan of care. Patient's pain is less than 4 on a scale of 0 to 10 in 48 hours. Yes, that's a correct one. It allows you to objectively measure the patient's perception of pain severity using a pain rating scale. So basically, the point is that you need to be able to evaluate it objectively and clearly. Interprofessional collaboration, all healthcare providers working together while respecting the expertise of those other disciplines. This helps ensure patient safety and effective care. Nursing interventions. What are nursing interventions? Nursing interventions are any treatments or action based on clinical judgment and knowledge that nurses perform to achieve patient outcomes. Always use critical thinking when you're making these decisions. Apply your nursing knowledge, the knowledge of the standards we have, our standards of practice, your experience. And if you're a new nurse, always consult other nurses who are experienced. And evidence-based practices. These are very important to incorporate into our interventions. These are the different types of nursing interventions. I know we went over this in the previous lecture as well, but you have direct care, indirect care, independent, dependent. Please go over these. Then we have standing orders. So now the important ones here I want to mention is direct care is something when you're providing interventions to the patient directly. You're interacting with the patient. Indirect care is, for example, when you're charting or when you're calling a doctor for a referral, but it's about the patient still, but you're not directly interacting with the patient. Now, standing orders are orders that we have in the hospitals. For example, in the ICU, if the patient's electrolytes, are off balance, then there are standing orders that you can turn to. For example, if the patient's potassium is low, you can look in the standing orders and there's an order for potassium. You can administer the potassium and notify the provider. So the orders are always there. Then you have care bundles, like a structured way of improving processes of care, like fall prevention care bundles, infection control care bundles. Then we have critical care pathways and protocols. These are standardized plans of care for situations such as falls, or you have situations such as the patient is unresponsive. There are different critical care pathways that we have for different patient situations. So now selecting interventions. What are the 6 most important factors to consider when you're selecting interventions? Desired patient outcomes. First, think about what outcomes do you want. If the patient is in acute pain, what outcome do you want? You want the patient to not have pain or have reduced pain. Characteristics of the nursing diagnoses. Make sure it's correct, it's accurate, it's based on the acceptable classifications. Research-based knowledge for the intervention. Make sure that your intervention is evidence-based and something that is valid. Feasibility for doing the intervention. Then we have acceptability to the patient. Is the patient okay with this intervention? It's very important for you to ask the patient and consult with the patient before planning these interventions. Then your own competency. So if you plan an intervention to do a procedure, do you know how to do that procedure? Do you know how to perform it? If you don't, then you need to find out and learn first, and then go do it. Make sure you know how to do it first. Now, in nursing intervention classifications, there are different levels and domains. Just as with the standardized nursing outcome classification, the Iowa Intervention Project developed a set of nursing interventions that provides a level of standardization to enhance communication of nursing across all healthcare settings and to compare outcomes. So the NIC model includes 3 levels for ease of use. You have domains, classes, interventions. And so you have 3 levels. You have level 1 is domains. It has 7 domains, and examples are like basic physiological interventions. Then you have level 2 classes. There are 30 classes and interventions, clinical categories when selecting interventions, physical comfort, promotion, things like that. Then you have level 3, which is there are 565 interventions over there. They can be used with NANDA, ICNP, etc. They include a variety of nursing activities to choose from. You don't have to memorize the levels of the different levels and the domains, but just know that these exist as a resource for you as a nurse. Then we have, for example, let's look at one of them. We have nursing diagnoses. Diagnoses is acute pain and chronic pain, right? We have one that's acute pain, one that is chronic pain. So the level 1 is basic physiologic. Remember, pain is basic physiologic. Then level 2 is classes, physical comfort promotion. We want to promote their comfort. Level 3 is interventions. What interventions do you want to use in order to relieve pain? Right? You have cutaneous stimulation, you have heat and cold application, you have pain management, you have nursing activity interventions are create calm and supportive environment, position patient to facilitate comfort. So these are how the different levels work. So you don't have to recreate the wheel. These are available for you, and whatever system your agency or hospital uses, they will provide this so you can use as documentation tools. Now we have the nursing care plan. The nursing care plan the plan promotes continuity of care, first of all, and better communication because it informs all healthcare providers about the patient's needs and interventions and reduces the risk of incomplete, incorrect, or inappropriate care measures. Nurses revise the plan when a patient's status changes. You don't keep the same plan because, I already did all this hard work to come up with this plan of care, so I'm just going to keep it. No. If the patient's status changes, you have to redo the entire process all over again. So now let's look at this. You have 4 parts to the nursing care plan. First, you have your nursing diagnosis. Make sure it's accurate, it follows the classification system, it's written correctly, it's relevant, you collected all the data you needed before you made that decision. Then you have expected outcomes. So what do you expect will happen at the end of your interventions, your outcomes? You set those outcomes. Then you have interventions for that patient. Okay, this was my diagnosis. These are my outcomes that I want to achieve. This is how I'm going to do it, and those are your interventions, right? Then we have evaluation. Once you complete your intervention, then you want to evaluate it. So that is what a nursing care plan is. Interprofessional care plans include the entire team that is caring for the patient. Recording care plans. You have different ways of recording it. You have student care plans, you have community-based care plans, you have handoff reporting, you have concept maps. There's so many different ways that you can record care plans. Evaluating outcomes. It's anything you do is meaningless unless you evaluate it. anything you do in life, right? For example, if you have a situation, a problem you're dealing with, you make a decision, okay, I'm going to fix this problem. You plan how you're going to do it, and when you implement your plan, you want to know, did it work, right? Without evaluation, you're not going to know whether it worked or not. So next time that happens, you wouldn't know what to do. So evaluation is very, very important, right? You record the date initiated and date you achieved those outcomes. You include a statement of achievement. For example, if you had the outcome was the patient will report pain less than 3 within 24 hours. So write that. Was that outcome met? Was it partially met? For example, maybe, it was a 4, or a 3, but the patient still was uncomfortable, right? Was it not met? Say it wasn't under 3. So list the actual patient behavior as evidence to support the statement. Don't just use your own judgment, use your own assumptions. Say, why wasn't it met? Why do you think it wasn't met? Because the patient said, my pain is not below 3. My pain is 5. So that means it wasn't met. So if it wasn't achieved, then put recommendation for revising the care plan. Okay, if the pain was not less than 3, now what can you do? Maybe you can do some integrate some non-pharmacological interventions. Maybe you can contact the doctor and say the pain medication doesn't work. And maybe the doctor can prescribe a different type of pain medication, or maybe prescribe something to go with the pain medication, such as a muscle relaxer to help improve the therapeutic effect. So this is an example. Medical diagnosis is anxiety. Assessment findings, these are your findings that you observed and, collected. Patient reports concern about wound not healing and keeping him from returning to work in 6 weeks. He has difficulty explaining what to expect during recovery, does not attend to explanation of risk factors, poor eye contact during discussion, he's irritable, his facial tension. What is your nursing diagnosis? Anxiety related to uncertainty over recovery and ability to return to work. Now, we don't have as evidence by statement over here, right? Major assessment finding, remember that was optional, so it's not included in here. What are the expected nursing outcomes? He'll have reduced level of anxiety. Patient shows less facial tension during discussions from recovery in 24 hours. Patient maintains attention during instruction about wound care within 24 hours. So these are SMART outcomes. Here's an example of a nursing intervention for you, because remember in the previous slide we talked about you have your medical diagnosis, you have your assessment findings, you have your nursing diagnoses, you have your expected outcomes. What are your interventions? Now, how will you achieve those outcomes? Right? You use calm, reassuring approach, encourage patient to express concerns, collaborate with the healthcare team, teach the patient relaxation exercises. And once you perform all those interventions, how will you evaluate it? You observe the patient's verbal, nonverbal behavior, ask the patient to describe his wound, how his wound is expected to heal during the next 2 weeks. Sometimes nurses also have to do consultations where they have to consult other healthcare providers, clinical nurse specialists, registered dietitian, therapists. Inexperienced nurses can also consult with experienced nurses. Right? If you have questions, if you don't understand a procedure, you can always reach out to one of the other nurses who's experienced. That's consulting. A nursing student can consult an instructor. When you're at a clinical and you're not sure about something, it's always best for you to reach out to your clinical instructor and consult them for help. So how do we consult? We identify the problem, choose the appropriate professional. Who do we need to reach out for? If it's a diet issue, then we're going to reach out to a dietitian. If it's a respiratory issue, the respiratory therapist, right? If there is a need for a medication or change of status, you want to reach out to the physician. Then you provide them the relevant information. When you're consulting them, make sure you have all that information organized so you can present it to them. Do not be prejudiced and influence the consultants, right? This is something we see in practice, and it's not a good practice. When you're consulting somebody, let them be the judge of what they need to do. Don't, try to influence their decision. Be available to discuss the findings and recommendation and incorporate their recommendations into the plan of care. And that is it for this PowerPoint, and the next one would be implementation.